Okay, hello, hello. I'm Kylie. I'm a birth doula based out of Los Angeles, and I'm here today with two amazing chiropractors, Dr. Annie and Dr. Risa. How are my fellow Glendalians doing today?
Great, doing well. How about yourself?
Oh, I'm good. I'm so excited to be here. So, before we jump into some of the questions I have for you, just to set the precedence of why we're having this conversation today, if you know me, I always say it's important to be an active participant in everything you're doing and bringing consciousness into what you're doing and, aligning with your body. And a lot of times, women throughout their pregnancy are recommended to seek out chiropractic care. And I've noticed that a lot of people don't quite understand what chiropractic care entails. They don't realize that it's more than just bone cracking and that it does a lot with the nervous system and balancing hormones. So, wanted to shed some light on that today. So, if you wouldn't mind, if you ladies could just kick it off by maybe sharing some of the, high level philosophies of what chiropractic care entails.
Yeah, absolutely. Um, so Dr. Ice and I are both I've been a chiropractor for 14 years. She's been a chiropractor for over two years now.
Hmm.
And the reason we got into this profession is because it is a natural conservative treatment, right? We're looking at the entire body. And when you're looking at the spine and the nervous system, they're deeply connected. And if you don't have a proper functioning spine, you don't have a proper functioning nervous system, which can lead to a lot of different issues in the body. And so when we're looking at pregnancy, chiropractic is so important and it's so beneficial because women are coming in with so many different symptoms. Their bodies are changing, their hormones are um, becoming different. And so going into care allows for them to have a better balance of hormones, allows them to have a better balance of their symptoms, allows for them to be able to identify what's happening in their body and know, like, is this normal? Is this not? And what can we do about it so that we can feel better?
Absolutely. And one of the things I love about chiropractic care is the, ultimate trust within your body and the ability to heal. That is something I think is just super important. So, being on the topic, of course, of pregnancy, what are some common reasons that women come into your office? Of course, I know that can be everything from something throughout pregnancy to helping put baby in optimal position, even helping kickstart labor and throughout labor. But if you wouldn't mind just sharing some specific reasons that people come in, that would be great.
Yeah.
Yeah, so the most common things pregnant women come in with are low back pain and hip pain, and this is often accompanied with sciatica, pubic and round ligament pain. That's also a really common one, and then followed by when baby's in a breech position. Um, there's also a lot of new onset of maybe mid back pain, neck pain, and headaches. We also see a lot of mamas with reflux issues, either in the beginning or throughout their pregnancies. So with chiropractic, as chiropractors, we're looking, as Dr. Annie mentioned, we're looking for those areas of the spine where the bone has gone out of alignment. And we are addressing those areas so that the nerves that are coming out of those areas are able to work as optimally as they should.
I love that. And going back to two things you said, I'd love to touch a little bit more even on the nervous system and the regulation of that, because of course that's so important throughout pregnancy. But the number one most important thing throughout labor is being able to, maintain self-regulation in a really regulated state. So are you finding that with women coming in for regular care that they're able to really access that more?
Yeah, 100%. I was just talking to Dr. Isa earlier about our patients that have maybe previously had pregnancies where they ended up, for example, in an epidural, and because their body was not prepared for it and it was such a stressful situation, almost often it ends up in a C-section. Whereas our patients that are getting chiropractic care and are their nervous systems being regulated better, even if they end up in a epidural, I'm sorry, not epidural,
I see.
Reduction?
induction, sorry, wow. Induction, they have better chances of being able to still deliver vaginally than end up into a C-section because their body is better prepared. They're able to handle the drugs and like the intensity and all of that.
Yeah, we've seen it sometimes too, where, babies maybe at station one, even though they're fully dilated and they were induced, but nothing was really, the natural process didn't really play out. So baby's kind of hanging out up there, and then hours pass, and then, we find that C-section situation. So I've heard of times where chiropractors have come in and done adjustments throughout the labor process to help with that. And so I imagine on the, front end. And one other question, you had mentioned breech. So I've had clients in that situation, and chiropractic has really helped with that. Do you see, like, what would you say the success rate in your own anecdotal experiences for, getting baby out of a breech position?
I mean, it really varies, but the sooner a patient comes in who knows that they're breech, the better the odds. We have a really good success rate with those, like the sooner that they're coming in. The ones that come in later, like they're like, hey,
I'm getting
I'm
induced tomorrow.
yeah, I'm scheduled in 2 days. Like I'm trying to sometimes we can make it happen, right? But there's obviously no guarantee in those situations. But the sooner we see a patient, the higher the success rates are going to be to get them to turn.
Yeah, that makes total sense. And going back to, I love what you were saying about, when going to chiropractic care, it really helps support the natural process of birth. So, how else does that play a role in supporting a woman's intuition and autonomy to have that natural birth? Is it, can someone come in one and done type of thing and it works? Or is it, but I mean, I would assume that coming in for consistent care works, but, maybe someone just found out or was recommended to come in and they can only come for a session or two. Is that still going to be as beneficial as maybe the person that's been coming throughout their entire pregnancy?
A good question. I think it really depends. Of course, anything is better than nothing. It's still support, but it's kind of like when somebody goes, I worked out once and it didn't work, or I changed my diet and I didn't eat that hamburger and it didn't work. It's gonna be the same for anything you do as far as prep goes for your body during pregnancy, right? So the sooner you or earlier you can get in to start having care, the easier time everything is going to be overall.
Yeah, absolutely. And is the, as far as, I'm just putting this out there because it seems very obvious, but just so I'm not missing anything. Um, this care too is also helping quite literally make space in the pelvis so that if baby is breech, they're able to move out of position. Or is there other things from like a mechanical standpoint, for lack of a better term, that we're doing to help, change the position?
Yeah, so with every visit that the pregnant mom comes in, we're always checking to make sure that the pelvis, the sacrum, the round ligaments, the pubic bone, we're always checking those things because the less tension and torsion we have in the uterus, that will allow for more optimal space for baby to be able to move around into position.
That makes sense.
Mhm.
Now I gotta ask, because I've seen this happen before. What would you say to somebody that is maybe reluctant or skeptical? Because again, I think the biggest thing, and this is the reason I'm glad we're having this conversation, is that people just don't really know. And the allopathic model doesn't typically support, it's a completely different school of thought, right? So there are times where I've seen an OB be like, oh my God, like it's so mechanical, but then they're willing to do all sorts of other things that to me seem a little bit more mechanical or brutal. So I'm just curious what would you say to maybe someone watching this that is skeptical or reluctant?
I always like to ask a patient and kind of start a conversation as to why. Like, why do you feel that way? Did you have a bad previous experience? Did somebody say something new and scare you? Because when it comes down to it, chiropractic care it's conservative, it's non-invasive, it's hands-on, there's no medication, there's no drug like injections, there's nothing. So there's nothing invasive about it. And so that in itself, it for at least for me, I would be like, oh, that's the kind of thing I would want to try first before I end up doing other things. And it's very gentle, it's very safe, it's very effective. We wouldn't have 2-day-old babies coming in if it wasn't. You know what I mean? We wouldn't be seeing 95-year-olds and adjusting their spines if it wasn't. So, we're trained doctors. We've been to school, and gotten our doctorate degree. We've been through countless boards. Dr. Rice and I have, we've been trained through the International Chiropractic Pediatric Association in pregnancy and pediatrics and Webster's technique. And so it is unfortunate when there are like OBGYNs or other MDs that are like, you shouldn't be getting chiropractic care, but they don't have any other solutions for the patient. They don't have a proper answer why. And I feel like that's not a great reason to not try something. And so we like to like open up that conversation and find out where it's coming from with them first so that we can address it, explain to them what we're doing, why we're doing it, and like help put them at ease so they're gonna feel better.
Yeah, for sure. And I noticed a lot of times with just the simple question of asking somebody why, they sometimes don't know where it's even rooted from.
Mhm.
And my doctor said so to me isn't really a good answer because you're within your own being and you need to have the self accountability to make decisions, especially if you're facing something like an induction. Something that's going to take a much harder toll on your body than what's going to happen with this is it's going to create space. We're going to get things, rocking and rolling. So then with that being said, are there any like major risks or, watch outs associated with this chiropractic care, especially with women that are pregnant?
The biggest thing that we see in our office is soreness. That's really the biggest thing that we see commonly in our office as far as what could happen after an adjustment.
And that goes for any patient that we
Yeah.
have. Because
Yeah.
we're explaining to them what we're doing, what we found, like what we're working on, what it's gonna feel like, what they might feel after. We give them instructions on like that what to expect. Are they icing? Are they heating? Are they, whatever. Um, but soreness is gonna be the biggest thing. Of course, there's risk involved in anything you do, right? I fell walking down the street and I tore my knee, meniscus in my knee. You know what I mean? And it was like nothing around. So there's always risk in anything you do, any kind of treatment, but the soreness is the biggest thing.
And at some stage during pregnancy, there's already soreness and aches and pains. So, nothing too crazy there. That's good to know. Thank you for sharing that. And I'd love to kind of wrap it up if you have any stories that some of maybe your favorite success stories, so to speak, like anything that really stands out that would be exciting to share with people that are watching this.
Yeah, we have a lot
Yeah, I know.
actually.
Actually, I'll start if you don't mind.
Yeah.
I'll start with the one that we had yesterday. She was a postpartum mama and she came back and she was like, I pushed for 45 minutes.
Okay.
Yeah. Easy. Like it was, we have a lot of those.
Yeah, we do. But that one was just fresh off my mind because she
Yeah.
just came back
We
after.
we had a lot of pregnancies this year. It was like a little post-COVID baby boom.
Yeah.
And we've had like second and third, especially like second and third like pregnancies. I pushed for 5 minutes. I pushed for 15 minutes. I had 2 pushes.
Oh,
Um, like labor was short. Their recoveries are they're doing great with their recoveries. But my favorites are the VBACs. So
oh, yeah, I love that.
I've had one patient. She had an 8-year-old. So with her second pregnancy, it had been a few years. She had had a C-section and she had a traumatic birth, and everybody was telling her like it's another C-section. There's no way. And she's like, I got forced the first time around. I didn't want it. She didn't want it. Like it wasn't her choice. She's like, this time around, like I want that support so I can do that. And I saw her through her entire pregnancy. We found her the right providers. She delivered naturally. We saw the baby day 2. Like she healed great. And we just had another one of our patients with her second child. First child was C-section. It was a difficult delivery. It was a difficult recovery for her. She wanted a home birth. She was able to have her home birth. She was delivered vaginally. She didn't have to push for too long. She's been home recovering with the baby. Like she got what she wanted.
I love to hear that.
and so happy for them.
Oh, I love that. One last question that came to mind because this is something that, we hear all the time. What if you're told, or what would you say to someone that's told that their pelvis is not conducive to birth a baby, or your pelvis is too small, or your baby's too big, or all the amounts of things we're being told telling a woman that she can't have a baby because of her pelvis?
Those are really frustrating for us.
Yeah.
Obviously, we're not midwives, we're not like doulas, we're not OBGYNs, you know what I mean? But we know anatomy, we know physiology, like and structure, and it's like we have patients of every age. Like we've got women in their 40s, late 40s getting pregnant. We've got like really petite gals, we've got larger gals, like we all kinds of structure.
Yeah,
And they're all able to give birth. Like it's a natural process.
very limiting
Intervention
thing.
if you need it, right? Like,
Right.
Totally. But
and
overall, I think it's a little limiting to be saying that because, like you said, I always say it's like Dr. Seuss. There's, people of all shapes and sizes. And then at some point, we're all here because there was a really tiny gal that birthed a really big baby in a field. And, I just see this happening where it's like something happens maybe where the baby's stuck in the pelvis. And then suddenly now it's the mother's fault because your pelvis just your body doesn't know what it's doing, of course. Now you need to come back and get a C-section. And I think that's a really common narrative for people that had inductions that went into C-sections, and now it's the pelvis talk. And I feel like it's a little bit of malpractice to tell a woman that like she can't birth a baby. And we're
yeah.
not going to look at any of the variables of maybe why that was.
Sure. And that's where chiropractic can be very helpful because alignment allows for better that positioning of that baby. You're not getting things like the
Yeah.
hand, or the crane neck. Like, you've got better, everything's lined up better so that when it opens and expands, you're ready to receive. You know what I mean? And things are not getting jammed up, if you will.
Yeah, totally. Well, thank you so much. This has been great chatting with you. If anybody wants more information, please feel free to reach out to Dr. Annie and Dr. Raisa. They're at Healthwise Chiropractic, and anything birthing related, you can feel free to reach out to me. And yeah, I'm sure we'll do another chat sometime soon, but I appreciate it.
Sounds good. Thank you for having us.
Yeah, thank you.
Of course.